Hey, I'm trying to talk about dry eyes. Many people have dry eyes, but they're not getting treated properly. You have to understand the reasons for dry eyes. Number one, most doctors overtreat the secretion of the tears. They'll give you things like Xiidra, Restasis, Tyrvaya. These are products designed to make you make more tears. If you're not a postmenopausal woman, or let's say over age 50, or have some autoimmune disease, it's pretty rare for you not to be making enough tears, okay? So this is the diagram of the eye. You can see that's the lacrimal gland that makes the tears, and they fall down here, go down the little hole in the corner of your eye and go down into your nose, okay? So before they treat you for making more tears, they should do a Schirmer's test. The Schirmer's test is basically this, it's like these little filter strips, and then you put these little filter strips in the eye. Here. They look like this, okay? So basically there's these little filter strips, you put them in the eye, like it measures how much tears are secreted in a certain amount of time. If you're not making enough of the tears, yes, then these products will work. Unfortunately, a lot of eye doctors don't do the first test to see if you're making enough tears, okay? So if you're on Xiidra, it doesn't work. And they never did this Schirmer's test where they put these little filter papers like on your eye to see how much tears you make. You'd have to come here and say, look, I never had a Schirmer's test. 90% of the time, we're going to find that that's normal. So that's why the Xiidra or Restasis is not working, is because you're not having a deficiency of the tears. You're not a postmenopausal woman or an older man or somebody with an autoimmune disease. The more common cause of dry eyes is that you're not having enough of the oils. The tears, lipid bilayer. So the first layer is the watery layer made by the lacrimal gland. On top of the watery layer, there's another layer of oil. Okay, so you can see this is the eye cut and cross section. Here's your lid. This is your eyelash, and behind each lash, there's like a little gland. Okay, so that gland is supposed to secrete tears, and then I would say in a lot of white people, it's not as common in Asians and Hispanics, but many white people, especially if they're Northern European or Eastern European ethnic origin, they have some condition called MGD, meibomian gland dysfunction. These are the meibomian glands, and basically, instead of them being secreting the oils properly, the oils are all just stuck in here, okay? So there's different ways we're supposed to be treating this. You're supposed to use like flax oil because that helps you secrete more oils. And then we have a device here, it's called Thermal One Touch. You kind of wear it in the office. It kind of heats up the glands. And then there's many different ways to heat up the glands. The glands have to be heated up because it's like melting a stick of butter, okay? So I went to a research seminar about MGD, and it says that unless you increase the temperature of the gland to over 105 degrees, which is the maximum temperature you have in a hot tub, it's not going to work, okay? So it's pretty hot. So there's other ways you can do it. You can do this at home with this little gel pack. You microwave it. A lot of people call it a warm compress. It's not going to warm if it's warm, it's not going to work. So I tried to train my staff to call it like uncomfortably hot compress. It has to be actually uncomfortably hot to get hot enough to melt this. You have to microwave this. You do it in like 10-second increments because every microwave's got a different power. If you just stuck it in for a minute, it might explode. And then you just put it in your eyes until it's not hot anymore. It's like a few minutes, like 2 or 3 minutes. Then you follow it with these lid scrubs, which are these, it's not like wash and dries for the eye. And then you're not really scrubbing, you're really just pushing and trying to express the glands. It's almost like popping a zit, okay? So if you look at the diagram, you heat this up, you get this to go from the consistency of butter to, I have toner on my hand, so it's not coming off, okay? So you're trying to increase this to the temperature of 105 or higher. It's like melting a stick of butter. Then you push in this direction to get it's secreted. It's like popping a zit. Now, if the eyeball were in here, it'd be really easy, right? Because you just go like that, go, and get all the stuff out, and go like, but you can't because the eyeball's there. So when you push in this direction, the eye kind of moves back and you can't get enough pressure. So that's why when you come here for Thermal One Touch, we actually have these little, this is like a little metal plate that we put behind here. We know about the eyes, you don't feel anything, okay? And then the doctor technician just puts this thing here, and then you have something to push against, you get more pressure, go like that, and all the stuff comes out. And sometimes we videotape it and show it to the patients. Now, there are many methods to heat up the glands. A lot of people talk about LipiFlow because it's like the #1 thing. The company's just promoting it a lot. But there's many ways to do it. You could do it with infrared. You could do it with radio waves like IPL. Our device just uses heat. It really doesn't matter how you melt a stick of butter. Afterwards, the most important thing is to push and get it out. Okay, so the price for LipiFlow in New York City is about $800 to $1,200 per treatment. We're only charging $500 for the Thermal One Touch, and we've had many patients say that they think it's better. Again, I think all the devices are similar in terms of heating it. It's just that we're actually expressing it afterwards with this little metal plate. You put that there and you push it, you get a lot of stuff out. After LipiFlow, they're not doing that. So I think that's why the results are not as good. Anyway, there's another thing called Avenova. That's if you have lid mites, okay? So there's a very specific form of blepharitis, which is not myelomyelitis. Blepharitis is a different disease. A lot of doctors, eye doctors, mix up these things. I'm a corneal specialist, so after I got trained in ophthalmology at Harvard, I actually went to Emory for a year just to do the front of the eye, okay? That's the cornea. So basically, blepharitis means you have like dandruff of the eyelashes, and there's a very specific form of blepharitis. You probably get closer to something, where you have like collarettes. I drew them in. So collarettes means you have a little collar on the base of each of these lashes, and that's Demodex. That's a lid mite, and the collar is actually the secretions of the mite. Sounds kind of gross, but again, 5% of the population has this when you look carefully, okay? So if you have that, they have a product called Avenova, and it's like got a special hypochlorous acid solution that kills the mites. So you first squirt this on your eyes with your eyes closed to just kill the mites, and then you follow this with this to kind of scrub it off. And a lot of times people with red eyes, irritated eyes, it's because the mites live here. They eat the secretions of fat that are stuck here from the myelomyelitis, and then they kind of crap and leave the crap on the lashes, and that causes an allergic reaction in your eyes red. So a lot of times when people have chronic red eyes and we notice the mites, and then we treat them with the spray to kill the mites, also we have to heat up the secretions and push it out to get rid of the food source for the mites. It makes them feel better and less dry and less red, because they're not as dry because the secretions are working, and they're not as red because the mites don't have any food source, and then we kill the mites with the Avenova anyway. Anyway, I'm just trying to say that 90% of patients who come to me for dry eyes or blepharitis or myelomyelitis have a wrong diagnosis. They went to an eye doctor, didn't specialize in cornea, anterior segment. Many people go to optometrists and never went to medical school. I'm not saying that there are not good optometrists that are logical and segregate the disease of dry eyes into aqueous production, the myelomyelitis and the blepharitis. There's a fourth thing. I would say 30% of the patients have a punctum that's too big, the hole in the corner of your eyes where the tears flow out. So sometimes if your hole's too big, you might produce enough tears. You might have enough of the oils that lubricate and prevent excess evaporation of the tears, but you're still dry because the hole's so big that everything just falls down into the hole. So there's a lot of patients who've had plugs or something like plugs. Here's the little punctal plug. There's a little plug in there. We have dissolvable plugs also, and we have cautery to make the hole smaller. So there are a lot of people who have plugs by an eye doctor where that wasn't the problem, okay? So that's a problem, because I've seen a lot of people with the plugs. They don't get any benefit from the plug because their main problem is actually the myelomyelitis that's getting treated wrong, or the plugs keep falling out, okay? So 20 years ago, I was putting in thousands of plugs a year. They keep falling out, and it's a big pain in the neck. So that's why I got away from plugs. And now we're doing cautery, which is just taking a heat probe and making this thing smaller. You don't close the hole, you just make it smaller. And that way all the tears stay in your eye longer. And we just did this patient today, by the way, who was complaining about fluctuating vision, not that great. I did the cautery on her, and right away she walks out of the exam room like, wow, I'm seeing so much better. So when you do that, it kind of proves the diagnosis was right, because just think about it. If you didn't have a hole that was too big and that wasn't the problem, and you made it smaller, she's certainly not seeing better, okay? But if you make the diagnosis correct and you make this hole smaller, you put plugs in, the tear film gets more distributed and they will see better. Anyway, again, if you've been treated with dry eyes and we're not having good results, I would suggest you come here. We take all kinds of insurance. If you don't have insurance, it's pretty affordable. The office exam is only $300. Again, the Thermal One Touch is $500, and that's, again, cheaper than it's going to be for LipiFlow. And I think the results are going to be better once you have a very methodical, holistic approach to treat everything. The dry eyes based on decreased production, maybe some blepharitis, maybe some myelomyelitis, and maybe the hole being too big. If I address all these issues, I can improve everybody's dry eyes. I've never had a treatment failure. I'm not going to lie. I'm not going to say that severe people don't still have some dry eyes. I'm saying that everybody who comes to me who sticks with the program and goes through the process has significant relief from their dry eyes, sees better, is less irritated, and less red, and that's pretty much what you want. Thank you very much. And again, this is Dr. Chen from Park Avenue LASIK. I was the first doctor in New York City to get LASIK himself, and I'm the only doctor in the world who actually lasered his own eye. That's because I switched to the non-cutting procedure, which is safer and, more importantly, on this topic, causes less dry eyes than LASIK and even less dry eyes than smile. So if you were told you can't have LASIK because of dry eyes, or if you're leaning towards smile because of dry eyes, you have to understand that smile causes less dry eyes than LASIK, but LASIK causes even less dry eyes than smile because it's totally non-cutting. Thank you very much.